Mr. Speaker, well, the Minister says there was no rhetoric or scaremongering last week. Can he explain to the House what the Prime Minister meant when she said, quote, "There will be staff here from overseas in that interim period until the further number of British doctors are able to be trained and come on board in terms of being able to work in our hospitals"? What did that mean? And what should we expect next? Ambulances plastered with go-home slogans?
This is exactly the kind of ill-judged remark which I'm surprised that the honourable gentleman in his first appearance here in post, and by the way I congratulate him, but I very much hope he will use more measured language rather than spreading this kind of inappropriate rumour. The interim period referred to was the period during which the doctors will be trained. We won't get new doctors coming under this increased allocation until 2023, and during that time, clearly, we will need to use all measures to ensure that we fill the spaces that I acknowledge that we have across several of our hospitals.
Appreciate the Minister's warm welcome, and I can tell him I'm very much looking forward to shadowing the Secretary of State. But his representations on ill-judged remarks should be directed at the Prime Minister, not me. We've seen 8,000 fewer nurses trained, student nurse bursaries set to be cut, a reliance on agency staff, a failure to train enough doctors, and now, after 6 years, they're talking about self-sufficiency. So can they tell us, post-Brexit, given that there are concerns that these plans do not go far enough, can he tell us what steps he will be taking to ensure that no staff from the EU will lose their jobs? And will this NHS, post-Brexit, still be able to recruit from the EU if necessary?
Minister.
Health ministers have been very clear to reassure all those 53,000 EU citizens who are working within our NHS that their roles are secure. Regarding the position on clinicians, I remind the honourable gentleman that although we have some vacancy rates which are acknowledged, we now have 7,800 more consultants employed in the NHS than there were in May 2010. We have 8,500 more doctors than in May 2010, and over 10,500 more nurses working on our wards. We have gone through a very consistent policy of recruiting more people to work in the NHS under this government.
Deeply grateful. Mr. Barron.